Hello everyone. You're watching sqadia.com and I'm Dr. Hamad Haider. Today we'll be discussing a very important topic related to the hip joint, especially a problem which is more related towards the older age group, that is hip joint osteoarthritis. So what is exactly hip joint osteoarthritis and how does it actually affects different age groups? For example, you must have heard nowadays the people undergoing total hip joint replacements. So what is the underlying problem for it? They are going for some form of replacements. That is most commonly the hip joint osteoarthritis is actually a degenerative disease of the hip joint. As you know, that hip joint contains certain structures such as, for example, this, if you see it over here, this is the proximal femur, this is the head of the femur, and this is an acetabulum in which there is an acetabular socket is present. Normal hip joint articulation is such that the femoral head articulates with the acetabular socket, and there is an actually hyaline cartilage which is covering over the top of it. Once this hyaline cartilage starts to degenerate, this could be due to over the period of time, or there could be something wrong with the hyaline cartilage itself. Now, this degeneration can be primarily due to age or could be underlying secondary cause as well. That is how we divide them into the primary osteoarthritis and the secondary osteoarthritis. So once the cartilage starts to degenerate, it will actually create a more of the bare areas on which the subchondral bone is exposed to the bony articulation over the acetabular socket. Once that happens, this starts of inflammatory process, which eventually the inflammatory cascades develop into degenerative osteoarthritis. And when that happens, usually you cannot actually replace the cartilage because that is actually protecting the femoral head. Sometimes you have to go for the complete replacement of the joint itself in form of a total hip arthroplasty. So when we are discussing the hip joint osteoarthritis, does this only occur in the hip joint or it can in any other joint as well? It can occur in the other joints such as knee or even the shoulder as well. But if you see it over here, this is another form which is actually depicting, this is the capsule. If you see it over here, this is the hyaline cartilage and it's covered in an acetabular socket. There is also labrum over here as well. This kind of, although this labrum which is present in the hip joint is not actually that thick, therefore it actually does helps, but not as it happens in shoulder actually. But it actually provides some depth to the acetabulum socket as well. And there are certain intra-articular ligaments and extra-articular ligaments which are actually holding the hip joint in place. Therefore, articulation of femoral head with the acetabular socket can take place. Once you see this is a normal hip joint, and if you see an abnormal one or in which the cartilage has actually eroded, you can appreciate the cartilage has degenerated over the period of time. Now it could be primarily due to aging or it could be secondary to some other cause, which could be anything related to mechanical or non-mechanical causes. When this hip will articulate, for example, this patient will flex and internally rotate. Now this head will hit this bony area, leading to increased subchondral collapse, subchondral cyst, and increased chances of subchondral fractures as well. That will actually not only create a cascade of inflammation but also pain. And pain is sometimes the most important thing because it limits actually almost all activities of daily living. A person cannot sit, person cannot squat properly, person cannot get up from chair. Whenever he or she is actually doing the activities of daily living, the problem is that there is actually problem occurring at the hip joint, and the life becomes quite kind of very painful and miserable if the hip joint is allowed to aggravate further and eventually leading to grade 4 arthritis. So that is how the osteoarthritis becomes actually kind of a nuisance for a person, because you need to do something about it, because patient just cannot carry on everything with pain, because he or she will feel pain whenever he or she will actually move the hip joint, and moving hip joint would actually aggravate his or her pain. And you can appreciate it over it. There is exposed bone and there's worn out cartilage, and this cascade once it gets started, it actually proliferates further, and as it progresses from grade 1, it goes to grade 2, 3, and eventually going to grade 4, because once the cartilage has eroded completely, it will start affecting the subchondral bone. Once subchondral bone starts to deteriorate, it will start affecting the whole of the femoral head, and eventually in the grade 4 osteoarthritis, that the whole of the femoral head is deformed, and actually the biomechanics is so disturbed that there is increased loading at a certain point, with other areas actually those are not exposed to weight bearing are actually relatively spared, but the area, especially the posterior superior area, which is more exposed to the load, axial loading due to weight bearing, is actually completely worn out, and there's a lot of pain and problem over there.